With 60 million heads of cattle, 160 small ruminants, and 400 million poultry, West Africa is an exceptional region for livestock rearing. In numbers and in comparison with the entire African region, West Africa contains some 25% of the cattle, 33% of the sheep, and 40% of the goat. Livestock rearing plays a key role in the economies of West African countries, providing about 44% of the total agricultural GDP. Like the rest of the West African countries, the livestock sector is faced with a number of challenges, including the lack of vaccines, inadequate veterinary services, and diseases. Animal diseases represent a permanent danger to pet and food-producing animals. According to the World Organization for Animal Health, at least 90% of livestock diseases are found in Africa, necessitating a widespread use of veterinary drugs.
We know that basically what comes is the nutritional deficiencies and then some viral diseases, yes, which is actually very common in Ghana, especially Newcastle disease, because about 70% of the production cost is from feed. So if they have problems with the feed, it means that they're going to get a lot of problems.
The challenges we're having in the region, one is transhumance activities, which is animal health problem. Really, Ghana as a country drive a lot of economic activities. A lot of benefit from transhumance. It still poses animal health problems, which according to veterinary service, links with zoonotic diseases and as well as animal health links to human health.
You can lose all your birds in a day if certain protocols are not observed, especially with the vaccinations. Gomboro, first Newcastle, second Newcastle, and all those things. If you don't do them well, you can lose all your birds.
There is already antibiotic abuse and antibiotic resistance, because some poultry farmers would use the antibiotic from day one without any prescription, in their feed or to even medicate their animals. They won't observe the withdrawal period. And so if these animals are slaughtered and we eat them, we are the end users, we could have resistance. And it has already been demonstrated. So there's a lot of study going on at the moment about antimicrobial resistance and antimicrobial use.
Recognizing the enormity of the challenge in the livestock drug sector, the ECOWAS Ministerial Commission in 2010 came up with the Veterinary Pharmaceutical Protocol to control activities in the sub-region. In Ghana, a farmers group, the apex body of women in Poultry Value Chain, with support from the WIPVaC Fund and partners, is championing the implementation of the protocol.
The apex body of women in Poultry Value Chain is an umbrella organization for all women poultry value chain artists, starting from where we get our breeder hens, where we get our eggs to hatch, where we get our day-old chicks, the input dealers like giving us feed, the veterinary drugs that we need for production, and those of us who are the poultry farmers who are producing the chicken and the eggs. Then after that production, we need to market, so the egg sellers are part of the chain, the live bird sellers are part of the chain, and those who are processing our chicken until it reaches the final consumer.
In 2010, we had this ECOWAS protocol signed in Abuja with the consent of the government of Ghana, because the government of Ghana was fully represented by the minister. Now, if you look at the ECOWAS protocol, it states clearly the role of the Veterinary Services Department in drug administration in the country. It's not that we wait for all this while. Since 2010, we've been working on how to get this protocol implemented, working. But then we have met so many bottlenecks, and that has been the biggest problem for us up till now.
The protocol basically talks about the procedures for handling veterinary pharmacy, that's medicines, the biologicals, that's the drugs, the vaccines, the serum, and all that in the sub-region. So this protocol helps individual countries go through similar procedures in order to register these products. And at the end of the day, it's their duty to report back to ECOWAS through a committee of experts set together, so that when you register a product in your country based on the set down rules and regulations, you can submit the dossier to ECOWAS with a committee of experts to vet this dossier for the manufacturer or the agent to pay for it. And once market authorization is given for the sub-region, that drug can be marketed in any of the ECOWAS countries, so that any farmer buying this product will be assured that the quality and efficacy of this drug is good for their productivity.
Basically, a whole set of regulations and directives for the whole sub-region, which is primarily aimed at the protection of plant and animal species and the control of plant and animal diseases, as well as strengthening the existing situations in the area of national disaster management, so far as livestock disease is concerned. Also, there are regulations aimed at preventing the extinction of certain plants and animals.
The protocol mandates the authority, which is the veterinary services, to be in charge of the regulation, the importation, the distribution. Everything about the protocol is on VSD. VSD is charged with that duty to implement it, like it's done best practices elsewhere along other economic groups and then in the sub-region.
The Veterinary Pharmaceutical Protocol has currently gone through Parliament. What is pending now are the gazetting and the adaptation of Ghana's laws to accommodate the protocol.
GPP is a Ghana poultry project, so we are working already for 4.5 years here in Ghana with the poultry sector, and there are, of course, we're looking at the whole sector, so one of these areas is the policies. And the issue in Ghana is that there's inferior drugs coming in, and the region already has developed 10 years ago, ECOWAS Protocol, which Ghana signed up on, and it was lying there to kind of move forward. And so it will be able to help Ghana to get better veterinary drugs for the poultry sector, so that the birds are having not inferior drugs, so that there's no threats to the health of the human beings by maybe having diseases that can be contaminated, or maybe by having the wrong drugs in the meat or in the eggs. So it's very important that this ECOWAS protocol is being put in place and moved forward.
We want the policymakers to know that this protocol is not for the farmers, it is not for Veterinary Services Department, it's not for FDA, but it's for all of us, because the implementation of the protocol would help everybody in this country to get quality animal products to eat. Because if the protocol is implemented and the farmers are doing the right thing, the antimicrobial resistance issues will be out, vaccines will be applied in the most appropriate way, and in so doing, profit will also increase. So we believe that animal health is human health. So if the protocol is actually approved and implemented, is to the benefit of society.
A smooth implementation of the Veterinary Pharmaceutical Protocol will mean a close collaboration between the Veterinary Services Department and the Food and Drugs Authority.
Currently, FDA is mandated to implement portions of the protocol, the portions that deal with submission of this protocol or the registered product to ECOWAS for market authorization goes through the veterinary authority, which is the VSD. And currently there is inadequate collaboration between VSD and FDA in order to actualize this protocol. What we've seen is that information flow within the agencies is not adequate enough.
More like we are now having a turf war, but we are all working towards one goal, for the good of society, right? I am interested in food security and public health. The FDA is interested in food security and public health. So why are we fighting a tough war? We don't have to fight a tough war. You understand? Yes. At the end of the FDA, we will not bring in drugs that are banned or that will not help us. In the same way, we are seeing that cede that little part of the animal drugs for us, because we have got people who are in the field to the lowest level, community level, where those things are going on. And they can go to the field and find out if what is coming in is what is being used.
People bring in vaccine from everywhere, and that is why even what we are working on is so important, because they bring in vaccines without any serious control. There are some diseases, we don't even have it in Ghana, but they'll bring the virus vaccine into the country. We had a problem like Gumboro, we didn't have it in Ghana. Somebody brought some beds and added some vaccines to it, and then we started having this Gumboro disease in Ghana. It's confusion, because, nobody knows who should do what, you see. And because veterinary, they had their disease of the Act in 1961, which was helping them, but it was deficient in a lot of things. Then the FDA came in with a new law, thinking that they have to control, but they don't have to. The ideal situation is to allow the veterinary authority to control all these animal health problems, so that they also control the human aspects.
Meantime, livestock farmers are anxious for the total implementation of the Veterinary Pharmaceutical Protocol.
The delay, I believe, is due to the normal maybe bureaucracy that we have in our system, because far back as 2017, this protocol was presented to Parliament, and in 2018, it was ratified. So 2 years now. And so when we realized that it was delaying, and you also need proper monitoring. If you go to the slaughterhouses, whatever you are doing, you don't know whether it's veterinary who's in charge or FDA who is in charge. Then we are running in between the two organizations, which is not working well for us.
Delay is likely to be part of it. However, the part that we farmers must play, and every stakeholder must play, is to ensure that this dream does not die and doesn't delay further.
The Booster Fund, with their donors, USAID, plus Danida, they are supporting us to carry out this assignment, and we are grateful to them. We believe that we shall surely cross the bridge, and the poultry sector would take its position again as it used to be.
I support and endorse the passing of the protocol. We are talking about eating healthy. We are talking about a disease like what we have, and all we are saying is boost our immune system, boost our immune system. And so if we eat good food, and in this case we're talking about checking the livestock, if we get something good, quality, then we think that we are helping the whole nation to even fight these diseases.
Animal health is always transferred to human health, and it is important to always have good animals so that anytime we eat, we also have good health. Animals give us the protein that the body needs.
Most countries in West Africa have currently implemented the protocol to the letter. A close collaboration between the Food and Drugs Authority and the Veterinary Services Department will improve livestock farming in Ghana.
Does this ECOWAS Veterinary Pharmaceutical Protocol now?
So, to ensure food security and food safety, let us implement the ECOWAS Veterinary Pharmaceutical Protocol now.
Strongly believe that ECOWAS Veterinary Pharmaceutical Protocol should be implemented now.
The protocol, we should implement it now.
But we are saying the time is now.
Let's implement it now.
Time to collaborate to get the ECOWAS protocol implemented is now.